What are the best treatment options for scoliosis? When a patient is diagnosed with scoliosis, very often their concern is, what is my best treatment option? And when it comes to scoliosis, we know there's not just one general treatment plan for every case of scoliosis. Every case of scoliosis is unique, and it's shaped by normally key patient condition and variables. Very similar to like what the size of the scoliosis is, the patient's age, the curve location, what type or causation could be associated with the scoliosis. Really, the complex nature of scoliosis really makes it necessary that every patient gets a customized, unique treatment plan based upon what they present with and how the curve is progressing or not progressing. And when we look at scoliosis treatment, we understand that there's really two basic treatment approaches. And one treatment approach is very different for the potential outcome and goals that it's having versus another. The two main treatment approaches, I like to break them down to something called traditional treatment approaches versus conservative treatment approaches. Even though conservative treatment approaches have different varieties associated with them, the goals with conservative treatment approaches are normally really different than traditional treatment approaches. Patients really have to ensure when they choose the treatment approach that's aligned with their expectation, what they're looking at achieving with the result of their treatment and what they're trying to prevent, really most importantly. When it comes to traditional scoliosis treatment, we know that there's not a lot of treatment really done before really the most invasive treatment option, which is surgery. Most treatment is no treatment. They're just watching and waiting for the curve to progress to a point when the curve has become severe enough or have caused enough problems to where now the doctors and patients react to the severity of the curvature to now say, okay, now we need surgery. So unfortunately, the traditional treatment option is very reactive treatment, and it funnels patients towards spinal fusion once these surgical levels are actually crossed and reached. So it becomes very frustrating for patients if they get to this level. They're wondering why didn't we do some type of treatment sooner? Why didn't we do something earlier before the curve became so severe that the only thing at this point that is recommended is surgery? Outside of scoliosis surgery or surgical fusion, the only other treatment that's recommended is something called traditional bracing. Now, traditional bracing has some very serious shortfalls when it comes to the treatment of scoliosis. First of all, they use it in a very, very specific group of patients. They only use it in adolescent patients that are still growing. That means they have to be in this rapid growth spurt, typically somewhere from 10 to about 14 years of age, 15 years of age. And normally the goal of this brace or these braces are just trying to stop the curve from progressing as fast as it's progressing. The goal is not necessarily to reduce the curve or make the curve smaller. The most common traditional brace is something called the Boston brace. And the Boston brace is something I like to call a squeezing style brace that addresses the spine in two dimensions. It's really just trying to squeeze the spine and slow the curve from progressing. This squeezing is really unnatural to the spine, and it's very common to have compliance issues because the brace tends to become less and less comfortable to wear because normally the curve is progressing and worsening while the patient's in the brace. So therefore, it makes sense that if the curve is worsening, it will get less and less comfortable, and therefore it has very serious compliance issues because it's not actually reducing the curve or making it smaller. It can unfortunately weaken the spine because if you just brace patients with no other types of treatment, it can lead to weakness because it's leading to just a squeezing effect like a cast would. And it unfortunately can cause some increased spinal postural deviation, especially in the rib deformity, meaning we know that the rotation can increase when you squeeze a patient, and the rotation is directly responsible for rib deformity. So we can see, unfortunately, increased rib deformity as a result of squeezing style brace. Spinal fusion, we know, is very invasive. It's costly. It can lead to lots of loss of mobility and range of motion. It can lead to loss of function of the spine itself. So by definition, because it's fusing the spine together, it is removing function of the spine that's supposed to be there. So it's a non-functional approach. It will, most cases, make your spine straighter, but not in a functional way, not in a way that's going to preserve spinal integrity and preserve spinal movement. It's going to do it in a way by sacrificing spinal function to get a straighter spine. And straighter doesn't always mean healthier if you're eliminating all function of what the spine can normally do. So therefore, conservative treatment approaches are different. The goal here is not to just reduce the curve and throw all function out of the window. The goal here is to reduce the curve while preserving function. And normally, proactive treatment is normally encouraged as opposed to just waiting and see what happens. So in conservative treatment, we're very proactive because we want to try to reduce the curve before it becomes severe. When you look at conservative treatment, this will be considered successful treatment, that they see a patient at 15 degrees and it progresses all the way to 39 degrees, 1 degree less than surgery, and that's considered successful because the curve never became surgical. Where in a conservative treatment option, especially in our treatment options at Scoliosis Reduction Center, our definition of really being successful is when we see the curve, we want the curve to be less than that when we're done. Not just less than surgical levels, but less than that. So therefore, we can treat curves much more early in the treatment cycle. The treatment cycle is integrated. It's multimodal. It's not just depending on watching and then a squeezing brace, and then if that doesn't work, surgery. We're using multiple treatments. We're using very specific condition towards scoliosis treatment programs. We're using very specific structural chiropractic care. We're using scoliosis in-office therapy and rehabilitation. We're using customized home exercises and home programs that are very scoliosis specific. And of course, we use customized corrective bracing. This non-invasive treatment works in reducing the curve, increasing core strength, and provide an optimal change for these patients. Now, a lot of times patients say, well, I'm doing some of this stuff already. I'm already doing some chiropractic care. I'm already doing some exercises, and maybe I have a Boston brace, and why is my not curve not reducing? And it's because the curve or the care they're receiving is not scoliosis specific. What I find is that a lot of patients that receive this conservative programs, they're like creating their own program. And I say their program is very fragmented. They go to a chiropractor to get some adjustments. They go to a physical therapist to get some physical therapy. They go to an exercise physiologist to get some home exercises. And they go see an orthotist who makes a brace. And all these 4 doctors or therapists are all kind of doing their own thing, and nobody's working together. And all those things can be effective, but they have to be coordinated in a way to produce a very good outcome. So what we look at here when we try to deliver this type of approach is, yes, the chiropractic care is chiropractic, but it's scoliosis-specific chiropractic, meaning it's structurally based on what we know that curve presents with. The therapy, yes, is a therapy, yes, but it's scoliosis-specific therapy. It's designed on a structural basis to be prescribed based upon the curve presentation that walks into the office. The exercises, yes, there are exercises to increase strength, but they're scoliosis-specific exercises based upon what the patient walks in with the scoliosis curvatures, and same thing with the bracing. Lastly is the way the care is administered. Most patients who do therapy and rehab do it slowly over a very long time, and I call that injury treatment. And the problem is that works fantastic for injuries doing low-dose, long-duration treatment, but it does not work so well for scoliosis because we do high-dose, short-duration treatment, which can make an impact on the curve size because it has enough intensity to actually reduce the curve in a short time. Follow this initial reduction. Now is when the corrective brace becomes a huge benefit, because corrective bracing can have much more benefits than just a typical Boston braces that squeezes. Conservative braces really, they fail at producing this corrective style approach that braces like a Scoli brace can provide. Scoli braces are really represent a culmination of modern bracing technology and design. It's just 3-dimensional design that we use to design one brace at a time for one patient at a time, based upon not only their body presentation, but their curve presentation, and also based upon the experience of the practitioner and their ability to fit the patient to get the ultimate correction possible based upon what we determine during their therapy treatment goals to help dictate what the end goal will be in the brace in terms of the corrective know-how. So therefore, these two things work together and they're very closely integrated. Therefore, the therapy and rehab and chiropractic care allow the brace to work better, and the brace allows the therapy and the rehab to work better. And these two things have to be very closely integrated and matched to provide the very best outcome. If they're all separated by different practitioners and different doctors, they're not going to be coordinated enough to provide a very best result. The corrective brace works by pushing the spine, not just squeezing it. And since the therapy and exercises are also pushing the spine, not just squeezing it, they work together and they address all the complex three-dimensional misalignments that can occur to help make the body move into a better position. Since the body is changing shape and moving into a better position, what's very known is that the brace now becomes easier to wear. So therefore, it addresses all the compliance issues. Most patients don't have a problem complying with wearing these types of braces because, number one, they see their body improving, but two, because since their body's improving and their spine is improving, their braces get easier to wear. It's just like braces on teeth. Braces on your teeth get easier to wear every day you have them on because your teeth are getting straighter and straighter. And it's the same thing is true regarding these braces because they're done in combination with therapy and exercises and they're corrective in nature. The brace should get easier to wear if you're getting better. It only gets more difficult to wear if you're getting worse. And that's what ends up happening with Boston braces. So therefore, at Scoliosis Reduction Center, we present patients with a very conservative treatment approach under one treatment roof, coordinated by one doctor to provide the most coordinated, multifaceted, multidimensional approach to deliver the very best results and not just slowing down curve progression, but most importantly, reducing the curve as opposed to just watching and waiting where you could be wasting very valuable time to get the very best reduction for your spine and health and well-being. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.